Good evening, everyone. My name is Manish Kumar Gupta, General Secretary, Team Wellness, and I'm your host for the sensitization event today. Being a part of the student community, we understand that this ongoing pandemic has, to some extent, disrupted our academics and personal life and unsettled our emotional well-being. To help deal with the situation better, Wellness Center IIT Roorkee is conducting this Barefoot Counseling Session for faculty members and students. The main aim of this program is to sensitize the teachers and wardens to common psychological behaviors, issues, and disorders, to equip them with basic skills to respond to students compassionately. So let's start the session by inviting our chief guest, respected Dean of Students Welfare, Professor M.K. Barua, to share his thoughts.
Thank you, Manish. Thank you. In fact, first of all, I would like to welcome all the guests from your dost and all the students who have joined this program. And let me tell you, this is a program which you have taken at right time. In fact, this was very much required. In fact, I am getting hundreds of emails every day that students are under pressure. In fact, Kiran is also getting, and our director is also getting mails. So students are under pressure. For the first time, they have been experiencing such type of phenomenon. They are at home. Probably they would not have at home for such a long duration in their lifetime. Many of them are having, relationship even with their parents. There are several cases of, quarreling with their parents. There are cases of, some academic related cases, financial related cases. So all sorts of problems are being faced by the students, and they want to come to this campus anyhow. Even they are saying that, in fact, those who are perfectly normal, they are also saying that we are abnormal. So allow us, because our wellness center, helps some of the, students who are slightly, under stress. So those normal students, they are also looking for this route. So I hope that this program would be useful for all those students who are at home and who are right now under quarantine at different locations. So without saying much, I welcome all of you. I hope that our students and our counselors will learn a lot from this session. So thank you so much. And thank you, Professor Kiran. In fact, as I told you, I have got a class. So please carry on. Thank you so much. And welcome all team members of your dost once again.
Thank you, sir, for sharing your thoughts. So the session will be conducted by Dr. Jini Gopinath. He holds a Master of Philosophy in Clinical Psychology from Kasturba Medical College, Manipal. He currently works as the Chief Psychology Officer at Yordos. He is also the elected Board of Director of Asian Society of Hypnosis and Hypnotherapy, and also a therapist and performance coach for Mumbai Indians IPL team. A warm welcome to you, sir. I request Dr. Gopinath to take over the session from here.
Thank you, Manish, for that warm introduction. Good evening, everyone. So give me 1 minute to share the screen, then we'll start the. It's visible. Thank you. So today I will be talking about a concept called barefoot counseling. This is primarily about the first aid in mental health, where we know that the number of mental health professionals are very less, right, in our wellness team in the campus also, and also outside. So is it possible for us as a friend, as a colleague, as a classmate, as a hostel mate to understand the psychological problems faced by our friends and help them in the beginning as a first aid before they connect with the psychologist or the counselor in-house or outside the setting. So like Professor Barua very clearly mentioned about the current context. So this current context is completely new to all of us. There's a crisis right now. So when you talk about a crisis, there's something like uncertainty, unpredictability about the current situation, and we don't know. So when we started in 2020 March, we thought that's going to be only for 2 or 3 months. But right now, even after 1 year, we're still struggling to understand what's going to come up next. So there is a lot of shift in the plans, and most importantly, the kind of coping strategies we had before may not be enough at this point in time to handle the current crisis. So we need to learn a new style of processing, a new type of coping, and it's bringing a lot of challenge in the system. And also, this is an extended period at home for most of us, right? Because you know, previously used to go only for vacations, interim breaks and things like that. But now it's almost like 1 year. Most of you are staying at home. The kind of conflicts you have with your family members, the kind of issues which you develop between your friends and other family members, which may not be possible for you to resolve it then and there itself, can also create a lot of problems within, and definitely the academic pressures. And because of this social distancing, this is kind of leading to social disengagement, where you're not able to meet people. The kind of, say, for example, the recreational activities which you had before, like going out and playing cricket or football, or those kind of group activities, are kind of suspended for the last couple of months. So there are a lot of issues coming together at the same time, and definitely there is a problems in the frequent or constant problems in the work-life balance. Not able to uh, discontinue certain things before you start the other area. Say, for example, you're sleeping very late, getting up in odd hours, which is creating a lot of problems in our normal day-to-day life also. We'll try to touch upon some of these issues going forward. So what do we do right now? See, how do we identify our peers who might require an additional emotional support? See, all of us are going through a problem. In the introductory speech, Dean very clearly mentioned that there is nothing when normal individuals are also going through problems, right? So that means to say that everyone globally going through some amount of issues. But at this point in time, how do we identify this among our friends and family members? And in the larger frame, self, is it possible for us to identify that whether we are going through a difficult phase at this point in time, and how to take charge of that charge of that situation? So what are the commonly seen problems now during this phase, and how do we identify it? The first one, which when a person going through an emotional difficulty, the usual response is a fall in the performance, whether it's a working professional or a student. This is going to be the first indicator. If there are no other issues associated with academics, this can be the first response. And you know that when we are emotionally loaded, definitely they have difficulty in attention, concentration, memory, problem solving, which in turn leads to being productive, right? Not don't think that almost all of them going through this problem will have similar kind of manifestation, like emotional issues in the form of depression, anxiety, or sadness and worries and tensions and all. But some of them can have a different type of manifestation in the form of anger, restlessness, frustration, anxiety, and things like that. Form of agitation and irritability, becoming kind of the tolerance levels are coming very low. We're getting um, anxious very easily, or becoming angry very easily. And you can see that the person is becoming irritated very fast. and different other manifestations also, like the frequent mood swings, unpredictable nature, and talking about a lot of negative things like including death wish, running away, avoiding, not able to cope up with these problems and things like that. In situations, in the extreme situations, we have seen that people coming up with a death wish, harming themselves, suicidal ideations, plans, even attempts. Also, the number of emotional issues reported from academic centers are also slightly on the high rate at this point in time, including suicidal attempts, crying spells, and even in some cases we have seen that people are not able to have the enough energy to perform the day-to-day activities, like intense fatigue, tiredness, lethargy, and things like that. So what can be done here? So how do we initiate a conversation with a person who is struggling? So I will take 20 minutes to complete the context. I mean, setting the context and presentation. Then we can have a discussion regarding the same. So we have identified two very commonly seen scenarios from the academic setting. And we'll also discuss about what are the primary counseling skills expected in handling these people, in terms of interacting with these people or people suffering from these kind of distress or disturbance. So this is a very common one. A student is experiencing conflicts at home, which is making her feeling distressed or disturbed. And this is making it difficult for her to maintain her productivity and focusing on her academics. So what happens here when after a long duration, she or he is staying at home, where all of them are working from home. That's another issue now. Previously, even though you are at home, you'll be staying at home only for 3 hours or 4 hours in the evening. Daytime, you'll be outside in the class or with your friends or something like that. But now, because of the COVID protocol, people are not able to go out. So most of us are working from home, studying from home. So everyone are at home, and most of the places where we may not have individual rooms for everyone. So we'll be sitting outside, and the timetable will be different for different people. So there will be a lot of disturbance in general. And if you're vulnerable to some extent and you think that you're not able to handle your normal day-to-day life properly well, so this can also create a lot of issues, and this disturbance can lead to productivity issues and cognitive functions. So we don't need to diagnose this people here, but it can create some kind of an impairment in their normal day-to-day life, which is very evident from outside. So as a friend, as a classmate, or as a hostel mate, or a team member, how do we connect with these people? What are the things which are expected? Remember, mental health, even now in the Indian context, is a very delicate topic. People do not want to talk about it openly. When I say openly, in the sense openly in groups, in, say, for example, you are a part of the class WhatsApp group, people may not be able to connect with the psychological problems in the open forums. So it's always good to address these issues one-on-one with the person. If you think they are struggling, they're suffering, and it's interfering with their normal day-to-day life. And instead of initiating this conversation directly with the problem, so start with a problem-free talk, an open conversation about COVID or about their life in general, about academics, and slowly migrate that discussion into the problem, if they are ready to connect with you. So forcing them to talk about the issue may not make sense here. When we talk about the first aid, if the other person is ready to connect, then communicate or continue the conversation. Always remember here, make sure that here your role as a psychological first aid person is basically to help them to share the problems. It's not like you are there to give them solutions or tips in terms of handling the problems. Basically, imagine that. So there's a very beautiful analogy given by a very famous mental health professional. During this COVID state, what happens? Almost all of us are like pressure cookers, right? And the problem with pressure cooker is pressure cooker comes with certain capacities by default. Some of us are 5-liter capacities, some of us are 10-liter capacities, some of us are 15-liter capacities. So what does it mean? It means that much load you can take. So beyond that load, what happens? The cooker will start giving signs that it's the pressure building up, reduce the pressure, right? At the kitchen also you can see that the whistle comes up. So what do you do when you have the pressure building up in the cooker? Either you reduce the flame so that little more pressure they can take, or lift that whistle or that lid so that some pressure can go out. Here in this situation, what happens now? For most of us, we don't have any control over the pressure. The pressure is constant. The only thing we can do right now is to release the lid so that some pressure can go out. So that is the primary agenda here. That's the reason why we mentioned that allow them to share. You be a listener in this context, and offering help in terms of connecting with them regularly, or taking them to the professional, the wellness center, the in-house counselors, or connecting them to your those. So all those things are a part of this process, and definitely follow it up. Where some people, they have a lot of resistance in terms of connecting with a mental health professional. Not like talking to a medical doctor. They don't have any problem in terms of taking medicines or talking to a medical doctor, but a physician. But when it comes to a mental health professional, there are a lot of apprehensions attached with that. So following it up with them is really important, because then we know that they are taking it seriously and connecting with the professional. So here, what is expected here is active listening. The problem right now, when we are in this social media networking space, most of us are trying to listen for reply, not necessarily actively being and listening to them. So here, the agenda here is paying attention 100% in that particular space itself, not checking the phone or thinking about what to respond immediately and things like that. Like I said before, our agenda is not about responding immediately. It's about giving them space and time and energy to respond and react to that particular space, and responding appropriately in the sense whether it can be non-verbally or verbally. You can connect with them, and also giving them a feedback. So feedback here is can be a summary of the conversation or something like that, which will help them understand that you are listening and you are interested in this conversation. This is very important for us to understand that active listening is very, very important in the primary phase of conversation with the person who is struggling and suffering. And by the way, in our normal day-to-day conversation is very, very less. None of us are actively listening. We are all in our own world. So it has its own limitations also. So the other commonly seen problem is about a breakup. A student is going through a breakup and is not able to concentrate on his or her own studies. He misses her constantly and is not able to get her out of his mind. So here, this is also, again, like I said, very frequently seen issue right now, primarily because of a couple of reasons. The distance itself can be a problem, where not able to connect with the other person and not able to be present when the other person needs you. A lot of things can be there, or there are multiple reasons, but this is also one of the common issue, the reason for having a breakdown, making the student more vulnerable. So here, so what happens very in like active listening, what are the other things can be implemented in your network in terms of making the person comfortable. So one of the primary skill set which is required for all of us in this kind of a situation, not only this situation, but every situation, every emotionally loaded situation, is empathy. So to make this skill set more clear, I will just initiate screen a video here. Let me know whether you are able to see and hear this.
So what is empathy? Why is it different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. At least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Yes. So, like I said, empathy is considered to be one of the primary skill set which is required for all of us, irrespective of the situation in any social context. But you know that in this situation, how do you know that the other person is an issue? Where how do you show that? How do you show that you are empathetic? How do you know that the other person is empathetic also? So this is basically about the first thing is that we are accepting the other person non-judgmentally. So this is one of the major issue which we see in social context right now, right? So we are not able to connect with the other person without judging them. So here, irrespective of the problem, irrespective of the background, we are going to judge. We are interacting with them non-judgmentally. Say, for example, somebody comes and tells you that I am going through a breakup. Instead of telling them that why did you get into a relationship first of all? That's which was very clearly seen in the video. So it's non-judgmentally connecting with the person. So it's basically connecting with 2 or 3 steps. Say, for example, the first one is about so the other person is struggling, an emotionally loaded state. So you're telling the person that, hey, I understand that you are feeling sad right now. So naming the emotion can be the first step. The second one is basically telling the other person that if I was there in your position, I would have felt the same. so that you're helping the other person understand that his feelings, emotions, his state of body and mind is being correctly understood by me. So this is what empathy all about. Recognizing the emotion and connecting the emotion at the right time. So empathy is also about taking perspective and connecting with the other person non-judgmentally. So what are the primary things can be done till they meet the psychologist or the counselor? Sometimes this can get delayed also, right? They may not immediately meet the psychologist. They may not immediately take the support of the counselor. So what are things can be done for all of us during this difficult phase to keep ourselves on track? The first thing which is going wrong at this point for almost all of us is our sleep. Most of us are sleeping on odd timings and are not having a proper schedule. Not having a proper schedule in our day-to-day life itself is a problem. But at the same time, when it comes to sleep, going to sleep odd timing, getting up in very odd time. So that what happens when you see the recent studies from sleep labs, they very clearly say that disturbance in your sleep, not able to get around 7 to 8 hours of sleep every day, can interfere with your attention, concentration, your memory, and at the same time your emotional response also. So the tolerance levels can also become disturbed if you're not able to sleep properly. So the sleep hygiene, going to sleep on time, getting up on time, not having caffeine or other drugs or other alcohol substances after 4 o'clock in the evening. So not having screen time, reducing the screen time in the evening, so that you will be able to have proper sleep, not the quantity but the quality, which is very important. So this is been highlighted because the common issues which we see from the academic centers, the most important one is sleep issues. Second one, having healthy meals on time. So if you're not having meals on time, the issues with the blood sugar levels can also vary, and the emotions which you experience can also go in a tangential way. So the physical exercises, which is again another problem which we see now because most of us are at home, and the avenues, the grounds or the playgrounds which are outside are also shut to some extent. But if you're able to have some kind of a physical exercise around 30 to 40 minutes a day, 4 to 5 days a week, because physical exercises are dose dependent. Doing it once a week or twice a week is not going to help you. If you're able to do it minimum 4 to 5 times a week, is going to help you. The kind of neurochemicals which are released are happy hormones, which will help you in terms of staying on track and seeing things from a different perspective altogether. And the recreational activities, which is again important. See, for example, the kind of recreational activities which you used to indulge in before lockdown, may not be relevant at this point. Say, for example, going with your friends for playing cricket and football and all, may not be always possible now. So, is there anything else we can do, considering the COVID system and the limited options we have, and indulging in an activity which is pleasurable, at least once. So make a list of things, around 5 to 10 things which you like doing, which you used to enjoy doing before, and try to see whether you can take at least one from that list in a day, and see that whether it's possible, so that that pleasurable activities can also bring in some kind of a relief in your system. And the last one, mindfulness. So mindfulness is Zen Buddhist practice. It's a meditative practice which can be implemented. By the way, it can be implemented in almost all activities in your normal day-to-day life. It's need not be where you need to sit in a particular place, close your eyes, and do this. In the beginning, when you start practicing it, you might need to do that, but it can be transferred easily to almost all activities in your normal day-to-day life, like mindful eating, mindful drinking, mindful studying, anything of that sort. By the way, mindfulness is basically moving away from your what to say. It's like the kind of automatic pilot mode which we have, that can be suspended, and you can be mindful about normal day-to-day life. So there is a very interesting Netflix series called Headspace, which I recommend if you are. There is an app also called Headspace, but before you reach that app, I would recommend you to watch this series, which will help you in terms of connecting with the physiology, the philosophy, the methodology of mindfulness, so that you can implement it in your normal day-to-day life. So what can be done? So last slide. How do we refer the individual whom you found or whom you've interacted till now? So when you talk about a referral, make sure that you are not aggressive, you're very gentle. Instead of telling them that you are a psychiatry patient or you are a patient, tell them that it's a difficult phase in their life, where taking support from another person is always helpful in terms of navigating this difficult phase more easily. And also remember that it's like not a patient doctor kind of a dynamics. Tell them that it's a support which they are going to take, and do not challenge the person, saying that if you don't take this support, it's like you will end up in a hospital or those kind of stuff. It's like educating them about the issue, and at the same time helping them avail the support systems available in your premise. So the wellness center, the counselors, the psychologists available in the wellness center, and also with your dost. Help take the first step here. What we thought was initially they will have a lot of resistance. So they may not be able to take charge in terms of booking an appointment or going directly to the psychologist. So in that case, if possible, as a person, as a friend, is it possible for you to take the first step by booking an appointment or helping them or accompanying them to the psychologist or the counselors in-house? This can be done. Remember, it may not be an easy conversation. And also remember that the resistance will be there in the beginning because of the stigma and the discrimination attached with mental health in Indian context. People may not be that easily connected with the idea of consulting a psychologist, right? So the resistance is normal. Resistance is okay if you're able to persist and communicating to the other person that asking for help is their right. Asking for help is their right, and helping them to execute this right. So this should be our agenda in terms of connecting with a person who is struggling and suffering, instead of pushing them to a mental health professional, challenging them and pushing them to mental health professional. This is the educative way, or connecting them to the psychologist. I think I'm done with the presentation. The agenda of this presentation was to initiate a discussion in this direction, where most of us are aware of these needs, these issues around, but we are very not very open in terms of discussing these things in our academic settings. So this was the agenda of the conversation. We can have a discussion right now if you have any questions or concerns, or if you want to share anything you think the models which you applied and it worked very well, we can definitely discuss on that line.
Can I ask a question?
Hello?
Yeah, Manish, it's Kiran. Can I ask a question?
So
Yes,
please.
sir.
Thank you, Dr. Gopinath. It was wonderful. I have I don't know how to put this question right, or how to talk to the students. So no, the students come back over and again with a request that they want to come back, or they want to come back to the campus. It's a practical problem that we're facing right now. So some of the students say that now they're anxious, depressed, symptoms of they kind of say all these symptoms. But then how do the counselors talk to them on the phone? We have WebEx link, or through MS Teams, we chat with the students. But how do you ascertain? You talk about empathizing with the students' concern, but then how do you ascertain whether it is actually genuine or not? No, it's very tricky. You want to empathize with the students' concern. At the same time, you want to keep them safe, right? Like, while traveling, or, because we have had this issue, a student who left a particular state with a negative report came here, and after 5 days, he was positive. So no, we empathized and said, like, okay, it's a genuine concern. But then, how do you convince them, like, hey, be patient, hold your horse, and then your time will come. So this is little, I don't know how to.
Yes, that's a very difficult question, by the way, Professor Kiran. But what I see is that most of the people want to come back to the campus, which we see in other institutions also, because they're kind of done right now, because almost 1 year they're at home, and the constant struggle and suffering from their at home, primarily because not always because of the struggles at home or fights at home, but they don't have any other option. They don't have any other venting space. They're not able to meet people. They're not able to go out because of the COVID and things like that. They feel that coming back to college can be one way of connecting with people. At least somebody will be there and interacting and things like that. But I would say that what could be the reason for their asking? Say, for example, is it because I feel disconnected at home, or I feel anxious at home, I want to come to the campus? Or is it like a genuine reason? Say, for example, there's a project to be completed and things like that. I would say that if the reasons are anxiety related or psychologically driven, then we might need to handle that first before we encourage them to come back to the campus. Primarily because running away from the situation may not help. It's a temporary escape. So the problems can persist, and it can mount to another level. So I would say that we need to empathize in that level, where we can handle their anxiety in their premise itself, if possible.
I was actually coming to that question. It's a rhetorical question. Like, hey, shouldn't we be training them to face the reality?
Yes, that's the reason I said, don't avoid. Instead of avoiding, expose them to that particular situation. Avoidance are always temporary. So I'm scared of dogs. So the common sense explanation is, don't go out. So you're safe. But I'm safe today, right? But what about tomorrow? What about day after tomorrow? So that's a very good question in that way. The context is like this, it's basically preparing them, helping them to face the reality in the long run.
Yeah, that actually has become a little tricky. Maybe the counselors will have a different opinion, but being the person to make a decision here, I can see the same question over and over and coming up. It's very difficult to convince over phone or via WebEx. Hey, like, hang in there, face the situation. But they take the easy route. Like the escapism is they probably no, I'm not trying to judge. I'm not trying to judge everyone on the same bracket, but they're trying to have a shortcut rather than to face the problem that exists, which may not be there, but like probably at least they have created that kind of a picture in the mind where it has probably it's a little difficult to convince the student to face it, in my opinion.
Okay. So I would like to see it from a different perspective also. I think other team members from the wellness can add here. So I would say that it can be a skill deficit also. Say, for example, I feel that I'm stuck here. I'm not able to cope up with this issue. The only option which I see is the running away from the situation to a different place where I think the system is slightly different. But actually, there can be a skill deficit because I know that there is a problem, but I don't know how to solve it. So empowering the student to resolve that issue by himself, by handling his anxiety, his worry, his tension in that particular station itself, will be more appealing in the long run, instead of helping them to come out of that particular situation where he feels suffocated. I think the suffering, the struggle which the student is facing is real, where there is no confusion in that. He feels that he's suffocated, he feels that he's stuck. But the reality is that he needs to face those kind of things also, because these kind of things can come up in the future, right? May not be in the similar form, but similar context. Say, for example, you can be in a relationship, a difficult relationship, where you may not be able to run away immediately, right? So instead of resolving that then and there itself, and running away from situation may not be a good coping mechanism. So I would say that the unlearning of some of the patterns which they had from the past is the right time, and to relearn or modify their learning is the right time. I think.
Thank you very much.
Yeah, Dr. Gopinath, actually, I also have one question regarding in the same line which Professor Kiran had. That sometimes, as far as I am talking about the BTech students, they are, I mean, most of the time we are telling that this is not the solution. If you are not happy at home, or you are feeling anxiety or stress or depressed because of family situation, or maybe because you are staying at home for a very long time, but still they are not willing to listen ourselves, and they land up here. And after some time, I think I mean, one of the counselor told me that after some time that student went back again. So it's very difficult from our part also, that a student doesn't want to listen. Okay, no ma'am, I want to come, हमें बुला लीजिए आप, हम लोग घर में बहुत परेशान हैं, ये है वो है, और still we are telling again and again this is not the solution. यहाँ पे भी आपको जो है online classes ही हैं, you are not allowed to go anywhere. I mean, you are not allowed to attend the classes and all. So in that particular situation, it is very difficult from our point ki, how to convince the student. That is main problem. I mean, फिर वो लोग कहते हैं कि मैम आप और लोगों को तो बुला रहे हैं, हमें नहीं बुला रहे हैं आप, और लोगों को तो wellness reason से बुला रहे हैं, हमें नहीं बुला रहे हैं. So I mean, it's very tricky also. I think
Yeah.
Give something. I mean, give some light about on this.
Some of the other institutions, what they have did was when the same line where the child is repeatedly insisting that, hey, this struggle is too much for me, help me. It's a cry for help. Sometimes it can be genuine. Sometimes we don't know. So in those situations, they call them and have multiple consultations over a period of 1 week, and help them understand the gravity of the issue, and also equip him with some of these resources. Something like tag him with a student counselor, a personal mentor, or a friend who can buddy him, something like that, and send him home after some time. So what happens, we have seen when we associate with some of these agencies, we found that the kids who are struggling like this, they really have skill deficit, right? They and we don't know, if you are very much insisting that, oh, don't come, you stay far, we don't know where we might lose them also sometime, right? So we don't know how they are going to think and implement and execute their stuff. So what I would suggest is that in the beginning, if we can have a proper one-on-one counseling multiple times with the wellness team or with you or those, that we'll be able to take care of that. Otherwise, if they insist to come to campus, then let them have a face-to-face interaction with the consultants there and take a call on that. But I strongly recommend that avoidance is the easiest strategy most of the people get in, because that is easily available. That's immediate relief. but that's just an immediate relief. It cannot sustain for long. So I would say that that can be highlighted in our conversation with the student, and most of them will be able to understand. That's what I feel. I'm sure that every institutes are, the kids are different and they have their own agendas.
Yeah, thank you.
Thank you.
Any more questions? You can raise your hand, students, if you have a doubt, if you want to ask some questions.
By the way, I strongly recommend that Netflix series on Headspace, which I think you all should watch, which is kind of a very good process on mindfulness. And once you are familiar with that, you can explore other apps also. So this series, because we can watch it very leisurely. There's no tension in watching that, right? It's very leisurely. You can watch it, and once if you are able to connect with that process, then you can take it up as a regular practice.
So, Dr. Jini, there are a few students who had questions in the registration form. Can I read them one by one, and if you could please address?
Yeah, please.
So one student says, how to stay motivated to work and learn new things during these difficult times, considering you are in no touch with friends.
So one of the, like I said before, one of the easiest way in terms of handling this difficult time is to have a schedule. So what is happening right now, most of us do not have a schedule. The college will be having some regular classes. Apart from that, the time which you spent previously talking to friends, going to the mess hall, or going out, those kind of free time, extra free times are there right now because you're studying from home. So how do you spend this free time? So I strongly recommend all of you to have a proper timetable right from morning till evening, the time you go to bed. And if you're able to stick to this schedule, then you'll be able to see that a lot of things are changing inside as far as the motivation and other kind of elements are concerned. By the way, in this schedule, you can add everything. You can add your physical exercises, you can add recreational activities, you can add your regular academic studying, reading times, and you can also connect with your friends on a regular day in terms of sharing ideas and insights about the academics and also non-academic stuff also. But by the way, the first thing is where do we need to start? We need to start with a schedule, which, by the way, not only for students, all of us are struggling with this.
Sure. So next question that I have here is, how can I be independent and strong in my life? I want to live my life alone. I don't want to depend on any friends or anyone else except for my family.
Okay, that's a very difficult question to answer in a short span. But I strongly feel that before we work on all the other things, we work on our mental health if possible. So if you remember the slide which I projected immediately after empathy consisted of three main things. Say, for example, how can we have a proper healthy or balanced life so that we can be independent. When I say there are different dimensions for independence, right? There's a physical independence, there's a financial independence, there is emotional independence. So we'll highlight on how can we be emotionally independent. I would say that going back to the same thing, having a proper schedule, sleep schedules, we have healthy physical exercises, meals on time, and having a proper goal. So when we talk about being independent, also comes with having a proper planning to the future, about the future, right? A goal setting also needs to be done. So the mental health professionals you are working with will help you in terms of goal setting also, which will also help you in terms of a destination is always important. The destination will direct your journey. It will streamline your journey. It will help you in terms of spending your energy, time, and money in the right direction. So these things at this point in time will help you in moving to the right direction. Some of these things may not be that easily attainable provided you are still a student. So a lot of the independence in some dimensions may not be that easily possible till you complete your course, but it can be a starting point wherein which you can direct your focus and life towards a particular goal, which will help you in terms of accelerating this journey. I don't know whether I have answered this correctly, but this is what I think.
I hope it helps. So we have one more question here. And the student says, after preparing for GEE for 2-3 years, I did not took part in any extracurricular activities, sports, arts, etc. And now when I see everyone being good at one or the other skill, I just curse myself for not being inculcative in any extracurricular activity in me. Everyone is showing up their skill, but I have nothing to show, ultimately leading me to loneliness and odd one out. I am losing a chance to communicate to others also. I am depressed. What can I do?
Okay, so here 2-3 points in this question. One is not able to have a extracurricular activity. Second one is being depressed. So which one is more impairing? I would say that being depressed, being sad is more difficult, right? When you compare with others. But anyhow, the first one is also warrants attention, where the other person feels that they don't have any skill set. But by the way, if you look into your past, you're talking about the 3 years you didn't have time for extracurricular activities, but starting from the childhood onwards, you might have been inclined to a specific activity. It can be football, cricket, or anything. By the way, skill set can be learned anytime. I think it's not like you are that old where you cannot cultivate a new skill or learn a new skill or master a new skill. But try to understand which one you connect with most, whether it's a sporting event or an art event or anything of that sort, and try spending a little more time on that particular skill set, or try to connect with people who share the same skill set, so that even being in that group itself will give you a lot of clarity about your interests and your inclinations and your your passion. So I would say that can be the starting point for you, and then you think of investing time and energy on developing a new skill. The second one, see, people loosely use the word depression. Depression is a clinical term, by the way, which consists of a lot of symptoms like persistent, pervasive sadness, lack of energy, not able to, not able to experience the pleasure from the usual activities which they engage in. But I'm sure that this may not be the case. We're talking about sadness as a component in your present life itself. In that, for moving away from that, the first thing is to start talking about that with the person whom you connect with. It can be a very good friend of yours, or it can be the wellness center in your campus, or your dost. These are all people who are available for you to connect with, so that you'll be able to understand what's going wrong inside, if that's the case. Also, remember, because of this emotional state, are you avoiding anything at this point? Because you think that you are sad, so I may not be able to enjoy the presence of other people, so let me avoid going out and meeting people, or let me avoid switching on my camera in this class, or something like that, where you make a list of those things and start exposing yourself to that situations also. These are all certain things which you can do in terms of coming out of it. But remember always, asking for help, asking for support is your right. The moment you feel that you are disturbed, you are sad, anxious, worried, tensed, make sure that you take the support of the mental health professionals available in your campus.
Great.
See, yes.
Yes, Dr. Jini, go ahead.
I think there is one question here: how to handle people who judge us right away. If we are mentally strong also, then too it leaves a doubt in us. it also decreases self-confidence. See what happens, we may not be able to change the way people respond. We may not be able to change the way people look at you, the kind of comments they pass, the way in which they look at the world. So the only thing we can change here is to the way we look at those situations. So here, the entire agenda of mental health support is to shift our focus from things we don't have any control to things we have control. So right now we need to understand, how do we handle this? How are we handling this till now? Generally, people avoid people making comments like this, or avoid situations where in which you think these kind of comments can come up, or moving away from places where you think even confidence is questioned and things like that. So I would say that the first thing which we need to understand here is that exposing ourselves to those people or those situations in a gradual way will help us in terms of maintaining the kind of confidence we have. One. Second thing is, how do we handle? So have a dialogue with them. So for example, most of the time it can be our assumption that they are judging that way. If they are passing a comment that way itself, instead of avoiding them, we can always have a dialogue with them. We can always have a healthy discussion with them in terms of what made them to comment that way, instead of accepting it. So I would say that somebody is telling you that, hey, you're not good enough. Giving a plain example, just you are going to present something in front of an audience, and somebody who is standing next to you telling you that, hey, you don't look confident, you're not good enough. I would say that instead of accepting that as it is, can we question that thought? So where is the evidence that I'm not good enough? Where is the evidence that I'm not confident? So you can see that instead of buying that idea as it is, the moment you start questioning that idea, you'll be able to know that you have a lot of evidences against it. Right? So weighing those evidences will help us in terms of staying in control. So I repeat once again, instead of accepting the comment, question that comment. Even though you're not questioning it to him, question it inside. Am I not good enough? Where is the evidence that I'm not good enough? Bring in data to support it. So that you will be able to see that that's just a comment, that's just a thought. So instead of reacting or responding to that, instead of avoiding because of that particular comment, we can have a different perspective altogether.
Okay. So I have one final question, Dr. Jini. Since the wellness team is also here, I thought let me just ask this. There is a student who has appreciated your those services for helping him in overcoming all the barriers and unleashing the best version of himself. However, lately he has been feeling very disturbed while he is in the hostel. And as per the student, there is a lot of disturbances due to some loud noises from in the other rooms in and around his room, which is really disturbing his sleep. And the student tells them, once I went outside to tell them that I feel disturbed, but I got intimidated by their personalities. They were literally huge, and I also anticipated that they were not sober. I returned to my room without saying a word. Next day, the same thing happened. I am very much annoyed, and I feel I should take a can and hit on their heads hard. It is happening very often. I am confused that I will commit this mistake someday and perhaps be punished by the judicial system for the same. Is this normal behavior? Does it happen to everyone? How should I overcome this? Please help me.
Okay. See, anger is a normal response, but how we express anger is very important. So here, what he mentioned was hitting the other person with the can and all may not be appreciated one in a social situation, right? I would say that alert the hostel authorities. If it is a real situation, the hostel authorities will take charge of that, right? If it's a really somebody is disturbing him loud noises and other things and all, the hostel authorities will support him in that journey. And the same way, he can continue the support of a counselor or a psychologist to express his emotions in a healthy way. Since he's in the campus, he can take the support of the wellness team also, right? If he's very much present in the hostel, I would say that two things. One is alerting the authorities. Second one is helping him to express his emotion in a healthy way. These are the two things can be done immediately.
Thank you so much, Dr. Jini. Any other questions anyone might have here?
Yeah, so I also want to ask one question. So maybe it is not a general question. Maybe it is a personal question. And sir, what happened is that I have been associated with Wellness Center from last about 2.5 years. And for the initial phase, we just talked that students are not asking for help, or they are not approaching us. They are not aware that they should ask for help. It is the first phase. But now, fortunately, from last 1 year or 6 months, we are seeing that huge number of responses from the students who are asking for help, seeking for help. So let's just keeping aside the first phase that students are not approaching. Now comes to the second part, that students are asking for help. Now when they ask for help, in several cases we manage to help them, but in many cases it also happens that we are unable to help, or even maybe we are not supposed to fulfill their demands or whatever he is asking, being in the position holder or in a professional behavior. So what happened is that sometimes guilt is there. So how to tackle with that, why I am here, even if I am not able to help him or her, so what is my job, why? So sometimes there is a guilt, so how to tackle with that?
So, yeah, that's a very good question, Abhishek. I think the problem here is that we may not be able to handle everything, right?
Yes, sir.
So there is a larger frame in which we all work. In that larger frame, whatever comes in between, comes inside, we'll try to help and try to support and try to navigate the entire system in that line. But there are certain things beyond our control, right? Certain things beyond our control that cannot be handled by us. Say, for example, you have already identified somebody requires support, and you brought him into the system, and they are taking support, but in between they discontinued, right? So what happens here is that what did they discontinue because of me? Because of me as a team member? That's there can be a lot of factors, right? There are a lot of factors present there. It can be therapy variable. Sometimes what happened, the client might have felt that he's fine now after, see, in Indian setting, what happens after 1 or 2 sessions or one session itself, they feel better, and they might discontinue thinking that the problems are over. So technically that problem is over for that point in time, but later when things comes up, then another breakdown can happen. But I would say that certain things you need to understand that certain things are beyond our control. So even though you are a medical doctor or a medical professional, you see thousands of cases in a month. Some clients might get worse in their manifestation. Some of them die also, right? But that doesn't mean that you as a professional is responsible for that. You've done the maximum you could do. So I think you need to separate. I think the boundary needs to be set very clearly. What is expected from you as a team member? What are outside your the extraneous variables, the variables which are outside your system, which you cannot control, right? So once you are able to identify these two, I mean, there's proper separation, the boundary, then things will be fine, I think. Otherwise, what happens? Everything you feel you are responsible, right? This person, I've told him very clearly to consult a psychologist, he's not consulting, so I'm responsible. He consulted, but he's not continuing. I'm responsible. So I think that boundary needs to be set. I think somewhere down the line, that could be the reason why. I think this is very relevant because, when we all started our practice, in the beginning, we all had this issue where we think that the client is not coming back for the next session. We think that we are incompetent. That's the reason why he's not coming back. Right. Or somebody started consulting another consultant. We think that, hey, I'm not good enough. That's the reason why he's consulting another person. But certain things are beyond our control. We cannot modify or manage or manipulate. That we need to accept.
Yeah, thank you very much, sir. I just want to add something that we will talked about the person who is taking counseling sessions, or maybe that may be the case in case of if we are a professional psychologist or psychiatrist. But in my case personally, what happens is that the kind of help students are asking is administrative type of help. For example, let's say they are saying that we have written a mail to let's say dean of student welfare, so he's not responding, or he denies my request, so what to do. Now I personally know that if being associated with the administration also and students also, I personally knows that maybe what are the factors our administration is denies his request. But I am unable to convince the student that I cannot do anything in this case. I cannot help you because I'm just only a student. So, and sometimes what happens is that the person in front of me who is asking sometimes say a few words which are very hurtful also. So yeah, so that's what
Yeah.
if
I
you
understand.
can share.
But here again, the other problem is that certain things are beyond your control. Right. So again, the same concept of boundary comes in. See, say for example, the student is blaming you for the dean not responding to the mails, isn't it? So that's beyond your control, right? There can be multiple reasons for him not to respond, not responding to the mail. Right, may not be it's worth responding, or he might have responded, or he might have postponed the responding. There can be multiple reasons for that. So I think somewhere down the line you need to separate certain things. That boundary setting needs to be done from your side, because everything you are including in your inner space itself. But I think that's not the right way of approaching. Right, certain things are beyond, outside your space, right, which you don't have any control. I think communicating to the other person is the first step. I think that you are doing it. Beyond that, may not be anything possible from your side, right? The only thing is that just ask them to wait for the actual response.
Thank you, sir.
I think no more question. I think we'll close it.
Any more questions here? Okay. So thank you so much, sir, for the stimulating presentation and question and answer session. I'm sure everyone here has learned something valuable from your experience. Thank you, sir. It was a great presentation. And moving on with the event, I'd like to request Abhishek Kumar, Deputy Chinsek Wellness Center, to give the vote of thanks for the evening.
So, good evening, everyone. Myself, Abhishek Kumar. So, it's my privilege to have been asked to propose a vote of thanks on this occasion. I, on behalf of Wellness Center, extend deep and sincere gratitude to Dr. Jini Gopinath for his important work and sharing with us his findings and opinions today. A big thank you to you, sir, for your efforts towards the sensitization of the students. And I want to mention the center idea you shared, that asking help is our right. We all need to understand that asking help is our right. So well, an event like this cannot happen overnight. The wheels start rolling weeks ago. It requires planning and a bird's eye for details. We have been fortunate enough to be backed by a team of very motivated and dedicated colleagues of your Dost, our online counseling partner, who know their job and also are result oriented. Also, I would like to thanks our chief guest, Professor M.K. Barua, Dean of Student Welfare, for taking time off his busy schedule and sharing his valuable thoughts. As he mentioned that he had a class and he just took off 5 minutes. So yeah, last but not the least, I would thank Professor Kina Mbatipudi, ADOS WSW, for his continuous support, all the counselors and the members of Team Wellness who played a major role in the organization of today's event. Thank you to all the participants also. Your coming to attend the event means a lot to us. And yeah, thank you, everyone. Thank you.
Thank you.
Thank you, Abhishek. Thank you, everyone. Thank you, Dr. Jini, for the session.
Thank you, Abhishek. Moving on, we come to the end of the session. I hope everyone enjoyed the session and definitely learned something from it. So let's continue talking about mental health and we can break the stigma. Good evening and have a great day.
So Rakesh